I'm really proud of our mission and the passion that I've seen all of our employees have for it.
I think CHS makes a grand impact on the community.
I hear a lot of times, I don't know what we would do without you. I had the opportunity to come to Beloit to interview for the position of Executive Director of the Beloit Area Community Health Center. And I was fortunate to be accepted for that and didn't realize that I would be starting a community health center from scratch. So that was a very exciting time.
We provide different types of medical services, including dental and behavioral health services to the community. And it's not always just the underserved or the uninsured, but just to the community as a whole, hence the name community. It's important that we realize what our community is. Well, the mission, basically, I have the mission statement right over here to my left, and it's basically providing quality care to all, regardless of their ability to pay. And that mission is especially to serve the underserved population. Now, our doors are open to anyone that comes in and is in need of our services.
Well, I really believe in the company and in the mission. That's the main reason I came here. I feel very fulfilled in what we do and the impact that we're making on the community. So it's really easy for me to speak to whoever we are recruiting, whether it's providers, doctors, nurses.
The favorite part for me working here is probably being able to be part of the team and being able to bring in staff to be able to, provide quality care to patients here at Community Health Systems.
A lot of people outside of the company that I know tell me that they like coming to our clinic and working with our doctors.
The patients, in whichever capacity, whether it's hands-on or you're working behind the scenes like I do, we all feel like we're contributing to the healthcare for underinsured and uninsured patients.
One of the myths about a community health center that I always try to get out is the fact that people think that we're a poor person's clinic and only people with no money can come to our facilities. But our facilities are very modern. We have technology and many private sectors that still are not using electronic medical records, and we have that. We also have the capability of providing telemedicine within our facilities. So we're very, and I am very technology oriented, making sure that we have the technology that we need to provide the services.
I think we provide an important service. There's a lot of people that are underinsured or uninsured, and we provide an affordable alternative, especially since so many got kicked off of Medicaid and Badger Care.
The administrative pieces need to be in place in order for the providers to be able to give our patients the care that they deserve. But in a roundabout way, I know that I'm helping the people, even though I am here with the papers instead of the patients.
We had patients come in, children come in whose teeth were rotted to the gum line. How can that service, how do you miss that? How do you let that happen? We see the uninsured and undocumented people come in, girls come in who are pregnant and have no other place to go.
It's important that when individuals come in that they feel that they are getting quality service, that they're welcomed, that just because they don't have insurance that they'll be denied the kind of health care that they deserve.
We see it all the time, whether the number of people that we see, the smiles on the people's faces as we come in, and just the things that we get when we see the patients makes a difference.
Being able to meet that mission for anyone that wants to see our services, but especially those who may not have insurance or have not the ability to pay, that they can get the quality health care here in our facility. That to me is really important, and that's what I strive in the mission of the staff to provide those services.